CataractCoach.com. European residents often learn in India. So some residents in some European countries are not really given an opportunity to learn surgery. So we have an anonymous European resident sent me this case. This is case number 100. And this young doctor in his or her own country in Europe was unable to get good surgical volume. Believe it or not, there are residency training programs around the world where the ophthalmology residents only learn medical ophthalmology and not surgical. And this young doctor wanted to learn surgical ophthalmology, in particular cataract surgery. So he or she went to India. And this is a neat opportunity. Now, it's more common than you may think. I actually know of a surgeon here in the USA who was in practice. And for many years, he did only LASIK and really just never did cataract surgery. And then decided somewhere in the mid-career that he really wanted to learn cataract surgery and incorporate that because, of course, that's an important part of refractive surgery is cataract surgery. So this doctor went to India and did one of these programs, go for a week or two and knock out a few dozen or maybe even 100 or 200 cases and really get some skills. And that's really important. Now, if you train in the USA for residency, certainly in the last 20 years, the nice part is you're basically guaranteed surgical volume. So ophthalmology residency in the USA is for sure surgical, and you will learn surgery. Now, there are some USA residents who don't wish to do surgical subspecialties of ophthalmology. Let's say they want to do just neuro-ophthalmology, or there's some who do just medical retina, no retina surgery even, no anterior segment surgery. That's okay. You find what makes you happy. But I think it's important, if you do want to be a surgeon, you do want to learn cataract surgery, the best way to learn is by doing it. And if you have a program where they're not teaching you how to operate, I like the initiation of this surgeon by saying, hey, the initiative is, let me go to India and learn it on my own. And I think that's brilliant. And I want to be thankful and appreciative of these opportunities. You know, if I want to learn a procedure too, I got to learn it by doing it for patients. That's how we learn. So I want to appreciate the patients and appreciate the professors. So what a nice opportunity for this young surgeon to say, hey, I'm going to go take a nice little trip. Let me spend a week or two of vacation time. Instead of sitting on a beach and reading a book all day or playing in the sun, let me help patients by doing cataract surgery. So let's watch the technique here. So a little bit of groove down the middle and then nice vertical chop. So that's a neat idea too. You make that little initial pit there in the nucleus. It really helps you get that phaco tip buried for a very high vacuum. So that's a nice 4-quadrant vertical chop. Went beautifully. This is amazing. So this is about 100 cases in. Now, I'm not sure if this young doctor has done all these 100 cases during this one period of time of, let's say, a week or 2 or 3 while in India, or the surgeon had accumulated a few cases or more cases before that. But this is just a fantastic way to learn, and that learning is learning by doing and, of course, by being taught by a professor, by being taught by an expert. Now, you don't have to be at an academic facility to be a professor. Let me tell you now, to profess is to teach, and you can teach anywhere. If you have a neat technique that you want to teach the world, hey, make a YouTube video. Share it with me. I want to learn. And so I encourage you all to be innovative and be teachers and teach the world. If you have a better way of doing it, let's learn from you. So really nice technique. So I'm happy with this surgeon doing a great job. You can tell sitting superiorly, instruments are in a nice position, eye stays in primary, draping is good. So this is just a really nice, clean case. And for case 100, I'll tell you, I'm pretty impressed. I like it. It's a really nice result. So let's see what else we got here. So putting in some viscoelastic here. Looks like HPMC, hydroxyprobamethylcellulose. And then you can clean up the case. Now, obviously, I sped the video up to 3 times normal speed. You notice the surgeon just changed the lighting as well to get more of that red reflex. And that helps you really pinpoint any of the extra lens cortex that's adherent or maybe lens epithelial cells that you want to wash on the undersurface of the anterior capsular rim. So, again, for case 100, I like this case a lot. Now, let's give some good pointers for improvement. So improvement, I think the incision is a little bit too much in the conjunctiva. You see some chemosis or ballooning of the conjunctiva, the bottom half of your screen, patient's superior position. Incision looks pretty reasonable. Otherwise, I like it. Rex's could be a little bit more round, but for case 100, honestly, that's a really good job, and it's going to hold the nucleus just fine. The chop technique, I think, was beautiful. Beautiful job of a vertical chop. You've certainly got that technique down. Keep in mind, though, that a vertical chop may not be as good for a very soft nucleus. If you have in your own home country a lot of softer nuclei, then you may want to try a different technique. Let's see the lens delivery. Looks like a single piece of acrylic going in the capsular bag, nicely placed. Yep, there it is, trailing haptic in two. So really nice looking case here, and now taking out viscoelastic. I'm impressed. Great job, young doctor. And I really am impressed that you made the effort and took the initiative to say, hey, I'm not learning enough in my home country. Let me travel to India and let me learn from some experts over there to become better cataract surgeons. So yes, you may be surprised. I've heard this from multiple residents in multiple different European countries. The next time you have surgery in Europe, you may be surprised to learn that your surgeon actually learned most of his or her techniques on a little trip to India. So thank you to everyone involved here. Thank you to this young doctor for sending in the video. And thank you to my Indian colleagues for, yes, teaching the world ophthalmology. There's some amazing surgery coming out of India, and I certainly love watching those videos and learning from them as well. Beautiful job. Keep up the good work. And remember, if you need to learn surgery, you take the initiative. You make it happen. You are in charge of your own destiny and your own future. And I got faith in you. You can do it.